Hello everyone, welcome to G Next Group. Today in this video we will discuss about top 10 most useful tips to prevent type 2 diabetes. Type 2 diabetes is a lifelong disease that affects millions of people worldwide. If you are overweight or you have a family history of the disease or you have been diagnosed with prediabetes, then you are at increased risk of diabetes. You can help reduce your risk of type 2 diabetes by following our top 10 tips and making a few simple changes in your lifestyle. So let's begin the video with our number 1 tip. Cut sugar and refined carbs from your diet. Consuming sugary foods and refined carbs can increase your risk of developing type 2 diabetes. Refined carbs or simple carbohydrates include sugars and refined grains that have been stripped of all brain fiber and nutrients, such as pizza, pasta, white bread, pastries, white flour, white rice, sweet desserts, and many breakfast cereals. When you eat sugary foods and refined carbs, your bloodstream is flooded with sugar, which stimulates the pancreas to produce insulin, which is a hormone that helps sugar get out of the bloodstream and into the body's cells. All this insulin can leave you feeling hungry soon after a meal, often craving for more sugary foods. This can cause you to overeat, and over time this can lead to progressively higher blood sugar and insulin levels until the condition eventually turns into type 2 diabetes. By replacing sugar or refined carbs with complex carbohydrates, you may help reduce your risk of developing type 2 diabetes. Complex, unrefined or good carbs such as vegetables, whole grains like brown rice, oatmeal and naturally sweet fruit digest slower, resulting in a stable blood sugar and less fat accumulation. Number 2. Exercise regularly. Regular exercise can help prevent the development of diabetes in people who have been diagnosed with prediabetes. It is important not only for managing type 2 diabetes but also for promoting your overall health. Exercise improves blood glucose control in type 2 diabetes, reduces cardiovascular risk factors, contributes to weight loss, and improves well-being. The American Diabetes Association encourages people to get at least 150 minutes of moderate to vigorous intensity aerobic activity per week. Aerobic activity at moderate intensity basically means exercising at a level that raises your heart rate and makes you sweat. Aerobic exercise can be achieved through light jogging, running, swimming, dancing, tennis, basketball, and more. Strength training, sometimes called resistance training, focuses more on building and maintaining muscles and can be achieved through body weight exercises or weights. These exercise types are all helpful in managing blood sugar and lipid levels and encouraging weight loss on their own. Number 3. Choose foods with a low glycemic index. Choosing low glycemic foods can curb blood sugar spikes and reduce your risk of developing diabetes. The glycemic index is a measurement system that ranks foods according to their effect on your blood sugar levels. Foods with a low GI value are slowly digested and absorbed, causing a slower and smaller rise in blood sugar levels. On the other hand, foods with a high GI value are quickly digested and absorbed, resulting in a rapid rise and fall of blood sugar levels. The GI of a food or meal is influenced by a number of factors, including the type of sugar it contains, the structure of the starch, the cooking method, and the level of ripeness. A number of studies suggest that low GI diets reduce blood sugar levels in people with diabetes. A 2019 review of 54 studies concluded that low GI diets reduced body weight and blood sugar levels in people with prediabetes or diabetes. One study in over 205,000 people found that those with the highest GI diets had up to a 33% greater risk of developing type 2 diabetes than those who consumed the lowest GI diets. Number 4. Lose weight if you are overweight. If you are overweight or obese, and particularly if you have excess weight around your abdomen, then you are at a greater risk of developing type 2 diabetes. Losing your body weight by even a small amount can help improve your body's insulin sensitivity and lower your risk of developing cardiovascular and metabolic conditions such as type 2 diabetes, heart disease, and types of cancer. According to studies by WHO, every kilogram of weight loss reduces the risk of diabetes risk by 16%. Moving toward a healthy weight can be hard because it involves changing the way you eat and your physical activity. Losing weight also takes time, which can be frustrating. Most people find it easier to make healthy changes in a few small steps instead of all at once. Set realistic goals within a time frame that works for you. Check your weight at least once a week and write it down, or consider how your clothes are fitting as a measure of weight loss. Number 5. Quit alcohol intake and smoking. Excessive consumption of alcohol and smoking increases the risk of developing type 2 diabetes. Too much drinking of alcohol may cause a chronic inflammation of the pancreas called pancreatitis. One of the consequences of pancreatitis is an impaired ability of the pancreas to secrete insulin, which can potentially lead to type 2 diabetes. Moreover, smoking not only increases the risk of diabetes, it is extremely risky when one has diabetes. The nicotine in tobacco is unhealthy for everyone. It can increase your insulin resistance, which means that your body needs more and more insulin to respond. Nicotine can also increase your risk for other diabetes complications, including heart and kidney disease, poor blood flow in your legs and feet, eye disease, damaged nerves to the arms and legs that cause numbness, pain, weakness, and poor coordination. The best thing you can do for your health is to quit smoking and drinking too much alcohol. Number 6. Eat a high fiber diet. Diets rich in fibers such as grapefruit, papaya, oranges, raisins, okra, lima beans, sweet potatoes, zucchini, granola, oat bran, and oatmeal play an important role in preventing and managing type 2 diabetes. Dietary fiber is a type of carbohydrate that is found in plant based foods such as fruits, vegetables, and whole grains. In people with diabetes, fiber, particularly soluble fiber, can slow the absorption of sugar and help improve blood sugar levels. A healthy diet that includes insoluble fiber may also reduce the risk of developing type 2 diabetes. The American Diabetes Association says that fiber acts like your body's natural scrub brush, which passes through your digestive tract and carry a lot of bad stuff out with it. By increasing your intake of foods high in fiber, you can help yourself in reducing your weight because these foods are filling and most are lower in glycemic index, which can help to control your appetite and have less of an effect on blood glucose levels. Number 7. Minimize your intake of ultra processed foods. Foods with preservatives and artificial flavors are ultra processed and are often high in sugar, fat, and empty calories. People who eat heavily processed foods like sugary drinks, chicken nuggets, frozen dinners, or sweetened cereals are more likely to develop diabetes than those whose diets contain more foods found in nature. Now, a large observational study published online December 16, 2019 by JAMA Internal Medicine links the consumption of such ultra processed foods to an increased risk of developing diabetes. The research suggests that a mere 10% increase of ultra processed foods in your diet is linked to a 15% higher chance of developing type 2 diabetes. To help reduce your chances of developing type 2 diabetes, it's important to live an active lifestyle, eat nutritionally dense foods, and avoid ultra processed products. Number 8. Monitor your blood sugar levels. Regular blood sugar monitoring is the most important thing you can do to manage your diabetes and prevent its complications. You will be able to know the effect of diabetes medications on your blood sugar levels, see what diet and exercise makes your number go up or down. With this information, you can work with your healthcare team to make decisions about your best diabetes care plan. These decisions can help delay or prevent diabetes complications such as heart attack, stroke, kidney disease, blindness, and amputation. Number 9. Avoid sedentary behaviors. Sedentary behavior like sitting down for long periods can result in changes in the body's metabolism, including insulin resistance, which can lead to type 2 diabetes. According to the study published in the journal Diabetologia, people who sit for long periods of time on a daily basis double their risk of developing type 2 diabetes, even if they take regular exercise. The researchers analyzed results from a study that suggested breaking up sitting time with 2-minute walk breaks every 20 minutes and found that it helped maintain glucose control and insulin response. Therefore, to reduce your risk of diabetes, avoid long sitting periods, try to take regular breaks, do standing meetings, walk during your lunch breaks. Number 10. Optimize vitamin D levels. Vitamin D, also called sunshine vitamin, plays a number of important roles in the body, including maintaining the health of your bones, teeth, and joints. Now, a growing number of recent studies suggest a link between vitamin D and type 2 diabetes. Studies have found that people who have insulin resistance and a low level of vitamin D may have a higher risk of developing type 2 diabetes. A small randomized controlled trial published in September 2019 in the European Journal of Endocrinology found vitamin D supplementation for 6 months improved insulin sensitivity and production in 96 participants who were at high risk of developing type 2 diabetes or newly diagnosed with type 2 diabetes. By just exposing your skin to the sun for 15 to 20 minutes each day can help increase your body's own production of vitamin D and thus reduce your risk of diabetes and other serious medical conditions. Thanks for watching. To watch more videos like this, subscribe to our YouTube channel G Next Group.